Hi, Dr. Yass here. In this video, I'm going to revisit a topic I've talked about before, but I am getting way too many people having this problem be a factor in the type of treatment they're getting and their ability to resolve their symptoms, whether at the lower back or anywhere down the leg. And what I'm referring to is the concept of having your pelvic rims on the sides be unlevel. So for many of you, you're having back pain or hip region or gluteal region pain or knee pain or ankle pain. And somehow through the process of your evaluation, whether it's through an x-ray, an MRI, or whether you went to a chiropractor, an orthopedist, someone has told you that your pelvic rims, the height of your pelvis on the sides, is no longer level, that one side is higher than the other. And in the case of the chiropractor, they're going to try to tell you, well, I could just mobilize you and make it be where it should be. And they'll just want to continue to do that for the rest of your life. And then you'll have the podiatrist who will tell you, well, the way you have to fix that is that you need an orthotic in your shoe. What's happening is you have a leg length discrepancy issue. One leg is longer than the other, so we just put an insert in, and somehow that's going to magically make your pelvis be level. The key to understanding why your pelvis is not level is to understand what controls the height of your pelvis. And what controls the height of the pelvis is a muscle called the gluteus medius muscle. It sits on either side of the pelvis, and it's attached from the pelvis to the hip joint. And when you are to single leg stand on one side, you no longer have the gravitational force of your body weight running through your leg to the ground because one leg is now off the ground. So without having a compressive force to push down and support you, what has to happen is if this leg comes off the floor, then the gluteus medius on the opposite side has to attach from the pelvis and pull down on its attachment from the hip joint. And what it does is it creates a suspension force on the opposite side. And when you create enough of a suspension force to support the weight of the lower leg, your pelvis is level and you're balanced, even though one leg is off the ground. So the ability to sustain a level pelvis is always going to be based on having equal force outputs of the gluteus mediuses on both sides. If one is greater than the other, then one is going to pull more on the other, and it's going to cause the hip on the opposite side to rise too much. Or it's going to allow the opposite side to fall, and this could lead to the lower back muscle on that side, called the quadratus lumborum, trying to compensate to help pull it up, and eventually the quadratus lumborum, or lower back muscle, strains and eventually shortens, and that pulls the pelvis up. But regardless of whether it's a weak glute med or so much that the pelvis on the opposite side is dropping, or it's being assisted and being raised on the opposite side because of a quadratus lumborum or lower back muscle assisting, the only reason that you have that variation is because the glute medius muscles on either side are not creating equivalent force. So that's the reason that you would not have a level pelvis. So if your pelvis is higher on one side than the other, I promise you, it relates to having a weak gluteus medius muscle. In terms of one leg being longer than the other, that's a tremendous fallacy. The concept of your leg length relates to the distance between the greater trochanter or hip joint to the lateral malleolus, which is the ankle joint. Nobody is attempting to measure that because you would see that those distances are equal on both sides. All that's happened is one part of the pelvis has gone higher than the other, but the leg lengths have not changed at all. Altered pelvic rim heights have nothing to do with the lengths of your legs. And certainly the idea of putting an insert in your shoe is complete insanity, because that is going to try to replace what the purpose of the gluteus medius is. And if you use an external appliance to replace what a muscle is supposed to do, that's only going to make the muscle weaker and actually feed into your problem further. So hopefully with this understanding, we're knocking off a bunch of issues. Why do you have your pelvis higher on one side or the other? You do not have balance of force output of the equal gluteus medius muscles. Because one side is higher than the other does not represent the leg length discrepancy. And basically, if you're having pain on one side of the back or in the hip region or in the knee region or ankle or foot, you could assume that if that pain is being experienced at the time that you're having some unequal height of your pelvic rims on either side, that's probably associated with the pain and should be included in the evaluation to determine whether the gluteus medius muscle, which is leading to the altered pelvic heights on each side, is also responsible for the pain you're experiencing in some place other than in that hip region and where the gluteus medius lives. So hopefully this is going to explain a lot to you, and you can put to rest all this nonsensical crap you're being told by all these practitioners who simply have no logical basis for what they're telling you. It is simply what they were taught in their curriculums, and no one has taken the time to establish whether what they was taught was valid or baseless. This is factual information. This is irrefutably factual and can be proven through a presentation of symptoms to show that what I'm saying is true. So if you feel this video is helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and click on the bell icon to get notifications when new videos are added. If you'd like to contact me regarding issues you're addressing, you can contact me through Dr. Mitch at mitchellyass.com. If you would like to schedule a Yass Method session, you could do so by going to my website, www.livewithoutpains.com. Click on the Schedule Now button. You have the option of choosing either an in-person session in Jacksonville, Florida, or a Zoom session. Fill out the information, pick the day and time you want, and you'll be all set. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.